Hello, everybody, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Jeremy Fallis with the Department of Communication.
And I'm Dan Ellman, also with the Department of Communication. Today, we're going to have a podcast about a podcast, namely the brand new Well-Being at Michigan Medicine podcast, which launched this week.
So before we get into that, be sure you get caught up on any episode of The Wrap you might have missed. You can find the shows on your favorite podcast hosting platform, Headlines, One Michigan Medicine, or on the Michigan Medicine YouTube channel.
All right, with that, let's bring in the host of the Well-Being at Michigan Medicine podcast, our very own Chief Well-Being Officer, Elizabeth Harry. Elizabeth, thank you so much for being here.
Thanks so much for having me.
So it's great to have you. Congratulations. It's been a full year for you here at Michigan Medicine, and congrats on launching this ambitious and helpful project. So what is the Well-Being at Michigan Medicine podcast all about, and what do you hope to achieve with it?
Thank you so much. And thank you both for your support in getting it out there. I think it has a couple of aims. One is, we know that it's hard to communicate about things that we're doing and things that we're trying to do to improve people's well-being and improve the way they experience their work at Michigan Medicine. Sometimes it can be hard to get the word out, and people learn in different ways. And this is one way that people learn. And so we want to make sure that for people that this is how they learn about new information, that we're getting them information this way. And so, really building on transparency and really building understanding about what's going on. Part of it is sharing unheard stories about our leaders. We have a lot of incredible leaders doing really neat things, trying to improve the experience of everybody who works, learns, investigates, or delivers care at Michigan Medicine. And, we really want the opportunity to highlight those stories, really kind of get to know those leaders on a little more personal level, and highlight a lot of those efforts. And then, the last main goal is really coming together as our Michigan Medicine community. There's always this temptation when we're struggling to other a little bit, or us, them. And it's really understanding that it's we're all in this together. We're all trying to improve these things together and really getting to see how we're doing that.
Yeah, I love what you mentioned, and we'll go back to both things that you talked about, but you mentioned leadership and identifying leaders who can empathize with and push forward positive well-being initiatives. That's really paramount to a functioning and thriving organization. So who were your first podcast hosts, and why did you choose them?
Yeah, really good question. So we started with the Triad team. So Julie Ishik, Charlie Royland, and Dr. Paul Lee. And we chose them because the Triad does so much in leading our operational initiatives on our clinical side. And they really have a lot of wonderful things to say about well-being and are huge advocates for well-being. I think, we'll explore some of their comments in this podcast, I hope. But, I think that there's hidden gems in what all of them have to say. And we were really excited to start with them to be able to kind of frame the institutional support for this. We talked with Dr. Andrew Rosenberg, who is our CIO, who has huge influence over many aspects of our roles that impact our operational efficiency or not. And getting his lens on how he thinks about well-being was really interesting. Dr. Amy Cohn from the School of Engineering, but she's also our Chief Transformation Officer at Michigan Medicine. And she and her team are doing incredible things and bringing a different lens, bringing this engineering mindset to improve operational efficiency, improve the way we do things, and address well-being. And Dr. Lou Edgy, who is the Senior Associate Dean of Medical Education, who is doing a ton of work in the space of thinking about well-being for all of our learners, whether it's GME or UME, and making sure that we're supporting all of our learners throughout the system. So it was really great to talk to her as well.
That's such a good cast of characters and guests to have on your first set of podcasts. And I think it does help humanize some of the leadership that the great leadership that we have here. And so let's dive into that first episode a bit. We have an opening clip here from Chief Nurse Executive Julie Ishak on fostering a culture of people for feeling cared about and how it can make a difference at work.
When you feel cared about and you feel a sense of belonging, it's a lot easier to come to work and do your best work. I think when you're feeling burnt out, when you're feeling a sense of not belonging to an organization, when you're feeling that people don't value you as a whole person, it is really hard to come here and forget about everything else that we're dealing with day in and day out. And so I think fostering a culture where people feel cared about, where people feel, in many ways, it sounds a little hokey, but in one of the other organizations that we talked to about well-being, about belonging, they said the foundation of it is love. And that sounds like a strange thing to say in a workplace, but it's really true. I mean, if you feel loved by those around you, you're going to be able to come and be your best self at work despite what's going on, and recognizing that we all have families and we all have things that are weighing on us heavily outside of work. And if we can feel a sense of belonging and well-being at work, we can then come and do what we're here to do.
So how important is that sense of belonging to well-being in the workplace, and how do you think we achieve it?
Yeah, I mean, wow, don't you just love that clip? I love that clip, and I love how authentic and vulnerable Julia is in talking about what can be considered kind of soft stuff sometimes. But I think this idea of belonging is so important, and it's so important that it's one of our base priorities. It's one of the 4 areas that we are strategically prioritizing as an organization. And there's amazing leaders helping advance that work and thinking about how we can include belonging and increase belonging. I heard this great term the other day, which is called Sonder, and it is the realization that everyone you meet has an entire complex life and events and things that are happening to them that are just as complex as your life, and that you're sort of an extra in their story, and that they have all this complexity as well. And I think realizing this about one another, realizing that we are whole people and we don't check that at the door, even though we are professionals, and we, try to compartmentalize that everybody has all the things they're going through, when they're in the workplace. And, we are all connected in that we are here because we care deeply about the mission of Michigan Medicine, and we care deeply about delivering excellent healthcare. And we're all connected in that we all have experienced all the pieces that go with that, which means all the difficulty and all the hardships and all the hurt and all the pain, and that connects us. And I think when we're able to connect over those pieces rather than divide over those pieces, it really serves us and helps all of us grow, individually. I think there's some great work going on in the belonging space. And I know the belonging team is really focusing on a book called Belonging by Jeffrey Cohen, where they really talk about situational crafting and creating situations where you can bring people together to work together to a common goal, even if they might have differing opinions or differing positions on things. And I think the final thing I would just say is that, we are a product of our larger environment. And my wish for Michigan Medicine is that we can be an example of what's possible, right? That we can be an example of a place where people can respect what other people are going through, and that we can disagree in a healthy and kind and intellectual way, but still care for one another as humans and really come together and have that cohesion. So I think belonging is everything to well-being. I think it's incredibly important.
All right, so let's take a little bit of a turn and talk about stress. I know recognizing stress and structural issues is one of the ways to stave off burnout and other issues related to work. So we have another clip, this time with Chief Operations Integrations Officer Charlie Royland, about leaders' role in recognizing signs of operational stress. Let's take a listen.
This is an industry that's for people by people, and will always be that, as far as I can tell. And so it's as foundational as it gets as leaders for us to be concerned with fielding the great teams of people that we need to field day after day to do the work we do. And so it sort of doesn't get more basic than the team and the well-being of the team. How do you do that? We talked a little bit about rounding. You're out listening, and stories are powerful. When a person actually doing the work tells you a story about what works and what doesn't work, that's incredibly powerful. You then back that up with data, and data take a story and say, you know what, it wasn't just a story, it's really happening a lot. And so you listen actively, you use data to drive what you do, and you try to improve the operations in ways that I think help our team members be great at what they do.
So let's talk about that data. What are some of the data points you're seeing that back up the stories that Charlie is talking about here when you've been rounding?
Yeah, well, I mean, I love how he phrases that it's, about people and for people and by people, and the first thing that I would say is that universally, when we round, I hear stories about the teams and how connected people are to their local teams and how strongly they feel about their local teams and how that is a really supportive feature for them in terms of their own well-being and why they stay and why they're here. And so I think it's really important for us to remember that one of our superpowers, that our special sauce is our people and it is our teams. And that comes across every time that we talk to people. And then there are things that come across that are not positive like that, right? That are operational issues that need to be fixed, or things that are hard, systems or processes in place that are hard, where people have been innovative and they've developed workarounds, but that as a system, we can help just make simpler. And so, as a result, a lot comes out of the rounding, a lot of improvement projects, a lot of issues are addressed and those loops are circled back. But we're also looking at building an MGROW program, which is getting rid of waste, where we will try to go through and find those spots of administrative burden and waste that are really making things harder for people. So those are absolutely data points that come out when we round.
I think that transitions really well into what we're about to chat about now and what we're going to listen to. It's about a system perspective, and it's about reducing cognitive load. We hear a lot about the administrative burden, about how people have just so much going on that it's hard to process everything that you got to do, whether it's your personal life, your professional life, or even the micro tasks that you have to do to accomplish your job. For us at Headlines, we've discussed ways to reduce the number of emails that people receive, or the new tools like InBasket and things that are designed to reduce that administrative burden. So we brought Paul Lee's clip. He's the director for the UM Medical Group. He was on your podcast, and he was just talking about reducing cognitive load. So let's have a listen to that.
Everybody who's a Michigan person knows Bo Schembechler's the team. And that is one of our core values. And so that's the underlying way we want to do this. We all play our roles. So one of us in our enterprise triad role is to really help address some of the structural factors that are upstream of people's experience and well-being. So we could try to do some blocking and tackling and to make adjustments for all the pressures that we know our teammates are facing. And so I want to really thank you, Liz, for your work in pointing out the importance of cognitive load for all of us and how that's creating both a sense of burnout if the cognitive load is too high, as well as really in a positive way, all the things we can do to reduce cognitive load. And so that's one of the core commitments that we have, is to reduce cognitive load. And that includes reducing administrative burden for things that don't work very well, or as you've pointed out, our medical group board meetings, the repetitive messaging of the same message over and over.
So Dr. Lee touched on some of those things. What else is there to get that cognitive load burden even further reduced?
Well, it's a great question, because I think we're in an era in healthcare where we're just starting to look at this. And so there's a lot that we can do, right? Anywhere from using AI in creative ways. And some of that can be ambient documentation for clinical notes, or helping our researchers on grant applications, helping our admissions teams on how they look through all of the documents that they have to look through, but really thinking about how can we leverage technology to help us with the volume of data that we're looking at. This is also, things like looking at the InBasket and looking at how much communication is coming through the InBasket. How many touches are there of each message? And are we being as efficient as possible when we route those messages around? And then things that we ask people to do as an organization, such as, our institutional mandatories. Do we need to do all of them every year? And do they need to be as long as they are? And I'm excited to say that last year there was a 40% reduction in the total time of institutional mandatories that was done with this goal of trying to reduce this administrative burden of what we're asking people to do. So we're just going to continue to chip away at these opportunities through this MGROW program, where we really focus on getting rid of waste.
I love that. And I've loved this look at and preview of the Wellbeing at Michigan Medicine podcast. I think it's been eye-opening. I think it's going to be an incredible series. Are there anything, any other topics that you're looking forward to touching on moving forward, either on the podcast or just in your daily work?
Yeah, I mean, I'm really excited. We're going to have some great guests on the podcast moving forward. We're going to have our Chief Innovation Officer, Dana Habers, who's running a lot of this AI work. So I'm really excited to have her come on and talk about how we're innovating our way out of some of these issues. We're going to have Dr. David Brown from the Office of Health Equity and Inclusion come on and really talk about some of these issues we've talked about the culture and about inclusion and belonging and how that impacts our sense of well-being. We're going to have our Chief Patient Experience Officer, Keith Gran, along with Devin Lippert from his office, come in and really talk about how does this impact our patients and how does improving well-being improve the patient experience? And we know there's a lot of data to support that link is there. And then we're going to have Jovita Thomas Williams, our new Chief Human Resources Officer, come on because HR is doing a ton in the mHealthy space and really advocating for employee engagement and really shepherding this mGrow program. So really excited to have them come on.
That's wonderful to hear. I think all those perspectives are going to be super helpful. And it all starts with the conversation, right? So having all these different voices and all these different perspectives is very helpful. So thank you, Dr. Harry, for sharing all this great information, and congratulations on launching this podcast, which will now be part of the Michigan Medicine Podcast Network. You'll be able to find that podcast on Apple Podcasts, Spotify, Stitcher, anywhere else you get your podcast. So please subscribe, like, listen, leave a review, do all that stuff everybody tells you to do with podcasts. Share with your friends and colleagues, and make sure we all have the chance to discuss this very important topic. We'll also have a story about the podcast launch on Headlines this week at mmheadlines.org. That's mmheadlines.org.
And when you're subscribing and sharing, do that with the Wrap too, right? Make sure that you're subscribing to those as well. All right, it's time for the lightning round when we ask our guests 4 quick fire questions that they don't know about. Dr. Harry, you're in the hot seat today. You ready to go?
I'm ready.
So fall is really in full swing. What's your favorite thing about the autumn season?
Gosh, I don't know. Is it super cliche if I say pumpkins and apples? I love all the pumpkin flavored everything, as well as going to the apple orchards with the kids. That's super special. And watching them get to do the corn mazes. I love all the fall things and the leaves.
I'm with you. All right. Now I know November 1st, a lot of the holiday music started in stores and on the radio and things like that. Is it too early for holiday music?
We've already started playing some pentatonics in our house, so I don't think so.
Fair enough. If there was one warm weather place that you could go to right now, price is no factor, no other obligations are necessary, where would it be and why?
Hawaii, because I always loved the humidity and the flowers and being able to do the hiking and the volcanoes. And I haven't gotten to take my kids there yet. And I would love to share all that with them.
That would be an amazing trip.
Flights are really long.
True. They are. All right. Thanksgiving is just about here. What is your favorite Thanksgiving food or Thanksgiving tradition?
Oh, pumpkin pie, hands down. I love it so much. So much.
That was easy. My gosh, I was expecting some sort of deliberation about multiple things to consider. And
no, there's no hesitation there.
No, but the thing, so I have celiac, so I have to find gluten-free pumpkin pie. So that's like, that's part of what makes it so special is if I find one, then I'm thrilled. I'm really happy. So if anyone has any recommendations, you can put that in the chat too.
Perfect. All right. Well, let's send those recommendations over to Dr. Harry and let's get that started. So thanks again, Dr. Harry, for playing along for the lightning round and sharing all the information about your new podcast. We are excited to listen to it. For more information about the Wellbeing at Michigan Medicine podcast, check out one of the top stories at Headlines at mmheadlines.org or find it on your favorite podcasting platform.
All right, Jeremy, we asked Dr. Harry where she'd go this very minute if she could escape with some warm weather, and she was going to hop on the very long flight to Hawaii. Where would you go?
Hawaii would be up there too. I've gotten to go once. It was amazing. I'd probably go somewhere south, somewhere in the islands, or maybe Central America or something. I do enjoy Latin culture and Latin food. So explore tropical rainforest or maybe a Mayan ruin of some kind and find a beach to hang out at. I think that would be something that I would enjoy. How about you?
Yeah, so I'm not really keen on the long flights. So I would probably shorten it up a little bit, and I don't even love the beach that much. So I'd probably go to Arizona because it's warm. You could drive around and see all sorts of different climates and cultures and beautiful, beautiful landscape. So whether it's Sedona or the Grand Canyon, or even just down in Phoenix and south of there to Tucson. So I would definitely go to Arizona.
I think that's completely fair. It's a great pick. All right, so it's time for the trivia contest. We are going to stick with the podcast theme for this one. So here is the question. What awareness month did we just recognize on last week's episode of The Wrap? Again, what awareness month did we recognize on last week's episode of The Wrap? If you know the answer, send it to headlines@med.umich.edu for a chance to win a prize.
All right, that's all we have for this week. Thank you so much to Dr. Harry for joining us. And thanks, as always, to our listeners and viewers for everything you do for patients, families, and each other. We'll see you next time.